Neuronal ceroid lipofuscinoses, or NCLs, also sometimes referred to as Batten disease, are a group of rare inherited neurodegenerative disorders that mainly affect children and adolescents and are one of the main causes of childhood dementia. They belong to a larger group of diseases known as lysosomal storage disorders, a group of metabolic conditions that result in the inability of a cell to break down certain substances, causing them to build up, ultimately leading to cell damage and death. With NCLs, there's a buildup of ceroid lipofuscin and other toxic waste products within neurons due to defects in lysosomal proteases or related enzymes. There are 14 different known subtypes of NCLs, named CLN1 to CLN14, each resulting from a specific gene mutation. Most of these mutations are inherited in an autosomal recessive pattern, meaning that an individual needs to inherit 2 copies of the mutated gene, one from each parent, to develop the disorder. All right, now NCLs predominantly affect the retina of the eye and the brain. The most common symptoms include progressive visual impairment that eventually leads to blindness and seizures, respectively. With early infantile onset, there's usually muscle weakness as well as a delay in development of motor milestones, like lifting the head or crawling. Later on, children may experience poor coordination, unsteady walking, and progressive loss of acquired motor abilities. Infantile and juvenile onset are also characterized by learning difficulties and developmental regression, meaning that a child may lose certain developmental skills that they had previously acquired. With a teenage or adult onset, there can be psychiatric symptoms such as depressed mood, sleep disturbances, bursts of aggressive behavior, and psychotic manifestations, as well as progressive cognitive impairment. Later in the illness, individuals may lose the ability to walk, talk, and swallow. Over time, muscle weakness can progress to cause severe breathing difficulty and/or feeding difficulty, which leads to death within the first decades of life. Diagnosis of NCLs can be challenging as its symptoms are often similar to those of other, more common neurodegenerative disorders that need to be ruled out first. Once the diagnosis is suspected, specific genetic tests can confirm the diagnosis by identifying the presence of the mutated genes. Additional tests that may be done to assess the progression of the disease include neuroimaging techniques, like a brain MRI, and an electroencephalography to monitor the brain's activity. All right, now treatment depends on the specific subtype of the disease. Individuals with late infantile NCL or CLN2 can receive enzyme replacement therapy with a synthetic form of a missing enzyme called cerliponase alpha, which can slow the loss of the ability to walk or crawl. Currently, there are no other specific treatments known to halt or reverse the symptoms of any other types of NCLs. For all subtypes of NCLs, seizures can be managed with anti-epileptic medications, and psychiatric and motor problems can be improved with medication. In some cases, artificial feeding via a gastrostomy tube may be required if the individual loses the ability to eat and they can no longer maintain their weight. Finally, physical therapy and occupational therapy may help individuals retain motor functioning as long as possible. All right, as a quick recap, neuronal ceroid lipofuscinoses are a group of rare inherited lysosomal storage disorders characterized by progressive neurological deficits due to the buildup of ceroid lipofuscin inside nerve cells. Characteristic symptoms include seizures, visual impairment, and motor problems. Diagnosis is confirmed via genetic testing, and treatment may involve supportive measures as well as enzyme replacement therapy in some cases.
Helping current and future clinicians focus, learn, retain, and thrive. Learn more